Asthma is an important chronic health condition affecting millions of children around the world. This video is about identifying symptoms in children that suggest the presence of asthma. Hello and welcome to this channel, Pediatric Doctor at Home, dedicated to the medical education of parents and caregivers of children and young adults. If you get value from any video here, a subscription would be very much appreciated. For a start, let's get a brief overview of the respiratory system. Humans breathe in oxygen through the nose, which then gets carried to the lungs through the windpipe, that is the trachea, then the large airways called the bronchi, and smaller airways called the bronchioles. In asthma, the airways and lungs are highly sensitive to certain factors or triggers which do not affect children with normal lungs. These triggers set off an asthma attack by causing spasm or tightening of the muscles surrounding the airways, extra mucus production, and swelling of the lining around the airway. All of these lead to a narrowing of the airway and obstruction of airflow in and out of the lungs, making it hard for the child to breathe. Because the body needs oxygen to function, having an asthma attack can be life-threatening. Let's talk about recognizing asthma in children. Asthma symptoms vary from child to child, and it is easy to miss asthma in very young children. However, the majority of children with asthma will have symptoms before the age of 5 years. A major symptom of asthma is cough, and for many children who are eventually diagnosed with asthma, this may be the only symptom. Although children cough from time to time, especially when they have colds, any cough with the following characteristics is suspicious for asthma. Cough that is worse at night or right after waking up. Cough that starts suddenly while playing or exercising. Cough that lasts for more than 3 weeks, that is caused by exposure to specific triggers and has a pattern of happening during certain seasons of the year. Another symptom of asthma in children is wheezing. This is a whistling sound produced when air flows through narrowed airways. About a third of all children wheeze in the first 3 years of life, typically with viral respiratory infections. Wheezing may sometimes be harmless, and some children eventually grow out of it. But wheezing in children is more likely to be from asthma if the following exists. 1. Recurrent wheezing episodes after being exposed to specific triggers. 2. A child with eczema, which manifests as dry, itchy patches on the skin, or a child with seasonal allergies characterized by watery, itchy or red eyes, sneezing, runny or stuffy nose when the seasons change. These conditions reflect hypersensitivity in other parts of the body besides the lungs. And number 3, having a parent or sibling with asthma. Other symptoms of asthma include shortness of breath or trouble breathing, and chest tightness if the child is old enough to describe this. Similar to cough and wheezing, these symptoms also appear in certain patterns after common exposures and during certain seasons. For a child to be diagnosed with asthma, there must be a recurrence of symptoms that improve or resolve after receiving asthma medications. Another important thing to note is that the symptoms of other serious medical conditions can look like asthma. That is why it is important to talk with your child's doctor so that the appropriate tests can be done to arrive at the right diagnosis. Thank you very much for watching. Feel free to leave comments and don't forget to subscribe, please. Thanks again.